Hormone replacement therapy is often used in the postmenopausal or what we call perimenopausal, which is a woman that's in the midst of going through menopause, in a woman that's in one of these situations, basically to treat the symptoms of menopause, specifically hot flushes, night sweats, even mood changes, and changes in the vagina. And the ways that this is given is if a woman still has a uterus, then we give estrogen with some progesterone. In a woman who's had a hysterectomy and doesn't have a uterus, then we can use just estrogen by itself. And there's a lot of formulations and a lot of ways that this can be done. There are pills that can be taken, and there are some pills that combine estrogen and progesterone. The advantage of that is it's a single pill to take once a day. It's much easier to remember. The disadvantage is that there's less options in dosing of how to take it because they basically come as a fixed ratio dose. And there's only so much dosing that you can get in a pill that has both medications in it. And so for some women, having a single pill that has both medications isn't going to work well. And so we generally want a small amount of progesterone, but we may need to increase the estrogen levels to pretty high quantities. And so sometimes we'll give a fixed dose, and if that's not enough, then we'll add extra estrogen on top of that, and you might have to take 2 pills. Now, another way to do this is to use a low-dose birth control pill, because that has a combination of estrogen and progesterone. In general, that's usually a lot more hormone that's given with normal hormone replacement therapy. But in a younger woman that's still sort of in the middle of going through menopause, sometimes it requires that type of dosing in order to make them more comfortable, and that's also certainly a safe way of doing it. So sometimes we use birth control pills, sometimes we use medicines that are a pill that combines the estrogen and progesterone that's specifically designed for hormone replacement therapy. An example of that, for instance, would be Prempro. It's a very commonly used medication. Now, we can also use patches, and there are some patches that have both medicines in them, or sometimes you might need 2 patches or a patch and a pill, depending on how you want to do that. In women that have had a hysterectomy, it's a lot simpler because we're only going to use one medication. And so you can use a single pill of differing strengths, that's the right strength for your particular symptoms, or a patch would work just as well. Now, in women that don't have problems systemically, they're not having, for instance, hot flushes or night sweats or mood changes, but really have just vaginal changes from the menopause, there's a cream that can be given, and these come in different types. Premarin vaginal cream is one, estrase cream is another. But it's basically a cream that's placed in the vagina with an applicator, kind of like what you would use if you had a yeast infection. And this can be given various dosing regimens, usually 3 times a week. It's put in the vagina before you go to bed, and it absorbs just into the vaginal tissues, and very little is absorbed systemically. And so it really decreases the risk of hormone replacement therapy and does a very good job of treating the local vaginal symptoms. So this would be things like vaginal dryness, pain with intercourse, or irritation because of thinning of the vaginal walls. If you're not having hot flushes or night sweats or those kinds of symptoms, this is a very nice way of doing it because it decreases the risk of hormone replacement therapy and gives very satisfactory results. Really, people feel much better that are having vaginal symptoms. This tends to go a long way. So that's another way of doing hormone replacement therapy. Now, the sort of standard medication that's been given, the standard estrogen product, is something called Premarin, which is kind of interesting to me because for some reason this has sort of gotten a bad name out there on the internet. Premarin is a completely natural product. It actually stands for pregnant mare urine. And so basically what they do is they have pregnant horses, they collect their urine, and they collect the estrogen that's spilled into the urine from these pregnant horses. The pregnant mares produce a lot of estrogen in the urine, and so they're able to get this estrogen out of the urine, put it into a pill form, and there's your hormone replacement therapy. Nothing really is more natural than that. But for some reason, people think of Premarin as this sort of, unnatural thing. It always kind of I always chuckle a little bit when someone comes in on Premarin and they say they want to be switched to a more natural product. And I say, well, what's more natural than horse urine? But it doesn't taste like horse urine or have any kind of urine byproducts in it. That's just where they collect it from. But there are other types of estrogens as well. There's estrase, which is made in the lab. There are estrogens that are derived from plant products. And then there are what they call bioidentical hormones, which are basically synthesized to be identical to the estrogen that's produced in your body. In my opinion, none of these has any advantage over any other. And so they all have similar side effects and similar risks, and they all work just as well. So whichever one you're more comfortable with, or usually whichever is formulated or on your drug formulary is probably the way to go. Progesterones are generally used as Provera is the most common one, but there's some other ones, Prometrium being another common progesterone that's mixed with the estrogen in women that still have a uterus. The progesterone creams are not really the right thing to use in this situation because the absorption can be erratic, and so it's difficult to know exactly what dose you have by a cream that you put on your skin. And so there are patches that have progesterone in them, but the creams are really not a very safe way of doing that. Progesterone creams by itself, without estrogen, are really almost useless because it's not the progesterone deficiency that's causing the symptoms, it's the estrogen deficiency. So there are people that will sell progesterone creams for a lot of money that are sort of specially formulated, and a lot of these people tell you that their progesterone cream is the only one that will really work. Honestly, this is a bit of snake oil. It's really placebo, and there's really no good medical evidence that this is any more beneficial than using a placebo as far as treating menopausal symptoms. So that's an idea of the different medications and the different styles of administration of hormone replacement therapy.